Logo and title text, Evidence Now, Advancing Heart Health, an AHRQ initiative. Below the title is the logo of the USA Department of Health and Human Services. Beside it is the logo for AHRQ, Agency for Healthcare Research and Quality. Text, looking to the future. Quote, "It is my hope that we are building towards what could be a regional extension service or a national extension service for primary care practices." End quote. Tess Miller, DRPH, Deputy Director of the Center for Evidence and Practice Improvement, AHRQ. David Myers, MD, Acting Director, AHRQ.
Going forward, I think one of the most important lessons from EvidenceNOW is that primary care, with this external support, can change how they deliver care for the benefit of their patients and their communities.
Tess Miller, DRPH, Deputy Director of the Center for Evidence and Practice Improvement, AHRQ.
It is my hope that we are slowly building towards what could be a regional extension service or a national extension service for primary care practices.
Sam Seichert, MD, Principal Investigator, North Carolina Cooperative, University of North Carolina, Chapel Hill.
I think we're at a point in time where we have to go beyond the walls of the practice and figure out how the combination of primary care with primary care extension centers and the right components can not only drive medical care, but drive health in the community.
Bob McNellis, MPH, PA, Senior Advisor for Primary Care, AHRQ.
EvidenceNOW has become part of the culture of primary care research, such that people who weren't even involved in EvidenceNOW talk about it as one of the most important primary care research projects that's ever been done.
Deb Cohen, PhD, Principal Investigator, EvidenceNOW National Evaluation, Oregon Health and Science University.
The primary care extension is always going to need a little bit of a research arm, both a state-based research arm to foster innovation and quality improvement, and also a national research partner who can help continue to cull lessons as we actually make this idea reality.
Caitlin Dickinson, MPH, Project Manager and Practice Facilitator, Northwest Cooperative, Oregon Rural Practice-Based Research Network.
I think we built some really cool internal infrastructure that now we're able to roll into other work that we're doing.
We are thinking about other potential ways that the EvidenceNOW model may help primary care practices get new evidence into practice.
To make this model work, to build capacity for primary care, no matter what the health condition is, we believe we've shown that the model can and does work. So one area we're going to move forward is putting new evidence into practice. And one of the most important areas is addressing the issue of alcohol misuse in the United States. So another thing we're doing is gathering states together to build infrastructure at a state level that brings together the Department of Public Health and institutes of primary care and academic primary care, and most importantly, a network of primary care practices in the state.
So we are already in the field asking primary care practices to implement screening, brief intervention, and medication-assisted treatment for unhealthy alcohol use in primary care.
For the future, we're hoping to expand the scale of EvidenceNOW, reach more places in the country, as well as the scope, and understand more broadly the challenges facing primary care practices to help them address them. We know, for example, that during COVID, it was devastating to many primary care practices. Many had to change the way they deliver care overnight, including implementing telehealth, which many had no experience doing. It was quite a challenging time for practices at that time to keep their staff safe and to keep patients safe. But what we heard through our primary care community was that for practices that have participated in projects like EvidenceNOW, actually had the tools and capacity they needed to make those changes more quickly. They were able to adapt and take lessons they had learned from EvidenceNOW from advancing heart health into how to address patient care during COVID-19. AHRQ will continue to look to those kinds of things to identify what some of those current challenges are in primary care, and then help them find ways to address them so they can deliver the highest quality care to their patients.
Logo and text, EvidenceNOW, Advancing Heart Health, an AHRQ initiative. www.ahrq.gov/evidencenow. Logo of the USA Department of Health and Human Services, and logo of AHRQ, Agency for Healthcare Research and Quality.